Hello, and welcome to our HCM 2110 course for the summer. My name is Dr. Ashley Parks, and I'll be walking you through an introduction to health systems organization. Please let me know if you have any questions. You can always reach me via email. This is my contact information here. You can also call and leave me a message. My office is located in Leon Levine Hall. However, during the summer, I'm often traveling as we're doing research. I work with the VA health system and several other hospital groups doing research. We will have optional live sessions Wednesday nights at 6 p.m. And during those sessions, I will be reviewing a piece of content, a lecture. You may notice that some of the lectures in our course that are added in on different weeks are just little snippets of content that I cover during those times. However, all of our content is pre-recorded lectures, assignments already posted, so you should be able to see and navigate everything fully asynchronously at this point, but you have an option to join me on Wednesday nights. Now, as far as what you'll get out of this class, my hope is that you'll get a good framework, a good general understanding of healthcare management, the healthcare environment, the different types of organizations, what we're looking at as far as improvements that we're looking for in the health system that we as healthcare managers implement, looking at quality, patient experience, cost, and also if you're pursuing a career in a different area, maybe public health or exercise science or kinesiology, this will provide you a good framework to understand billing and payment processes and insurance and a little bit about general management principles in our health system. Now, we are going to discuss the forces that shape the U.S. healthcare system. So we'll talk about the policy and environmental elements. We'll talk about the functions, missions, structures of different types of organizations providing different types of services. We'll discuss different key issues. And then, of course, the role of health services managers in the U.S. healthcare system. Now, we have a lot of different course objectives. These are the key ones related to the beginning of our course. So we'll be talking about understanding organization, financing, cost, outcomes of the U.S. health system. But we'll also spend a lot of time talking about different models, different ways of viewing and interpreting and approaching problems in the health system. We do have a course communication policy posted here. You can see that you're able to join me in my Zoom room. Also, I will try to grade and post grades as quickly as possible. It's normally pretty quick during the summer. But my general policy is up to 7 days. Give me 7 days to look at and review assignments. And then if you're wondering where your grade is, please inquire. Otherwise, I'm working on it as quickly as I can. As far as email outreach, please feel free to email me. Now, on the weekends, you may experience a longer delay. I may be on a long run or on a trip. And so it is the summertime. But in general, all my email comes to my phone and I generally respond pretty quickly. Our textbook, we use the She and Sing Essentials of the U.S. Healthcare System textbook, but there are a lot of other resources, podcasts and YouTube videos and articles that are posted in our course to help us learn a little bit more. Again, we have these optional Zoom sessions. They're always in my Zoom personal room link that's provided here. There's a lot we'll be covering in the course together. We have 5 interactive online discussion forums. So those are spread throughout our 5 modules in our course. We have 4 journal entries. These are short papers. We have 3 exams, 3 slightly more detailed short write-up papers. Those require references, whereas the reflections don't. And some online activities that are going to help you keep pace with the course and practice the course concepts as we move through. There is a team assignment due at the end of the semester. So I will be asking you to prepare a presentation, and we'll get to that in a little bit, on a health issue. You have a couple different lenses you can approach it from. You can talk about a payment model, a model of care, a method for financing health services, a new healthcare technology. A lot of students choose that, especially with the advent of AI and robotics and other things in healthcare. So there will be a team element, but you have several weeks to get acquainted and ready for that piece. As far as how the grade will be calculated, that team final presentation is 10% of your grade. 10% is your online discussion forums, 20% are the other activities, including your journal entry papers and your short papers. And then 60% of your grade in this class is made up of 3 exams. They're primarily multiple choice with a few free response. And so those make sure that we're making progress and checking in throughout the course and assessing where we're. Now, if we look at our course schedule here, you'll see that we cover a few chapters in each of the 5 modules. And the last column is what you really need to pay attention to. Those are the due dates. It's important to know what we're learning and why. So we have our course objectives and module objectives. And then what the resources, readings, and materials are. But that last column has all your due dates. So if you go through each one of these modules and make a note on your calendar of all these due dates, you'll be set for our summer semester together. Now, going back to the top, you'll notice that the first things due is there's a pre-course questionnaire and a syllabus quiz due the first week of our class by June 2nd. There's also a class introduction discussion post where you'll need to post about yourself and get to know a few of your classmates. Those are the only things due in the first week. You have until the second week then to work on our first content discussion board on health equity and start to work on your first reflection and short writing papers. Now, when we look at our view module by module, you'll notice that I have specific articles and readings listed. However, in the course itself, under each module, there's a link for lectures and readings. So all of this is available in your course. All right. Of course, professionalism is very important. Please reach out to me as you ask questions and need assistance. I'm going to treat you like a professional, and I hope you treat me like a professional. And our goal is to create that safe space together where we all want to learn and grow. There's some resources linked here related to the counseling center and of course our food pantry, which is a wonderful resource if you're on campus. We have a food pantry on the 5th floor where my office is located. I do want to stop for a moment. Sometimes I forget to discuss this, but the food pantry is not just food. It's a resource center. So if you go in there, you'll see toiletries and other things, but there's even clothes. So if you're looking for an outfit for an interview, there's other resources on campus through the Career Center, but I love that there are donations and things available there. So check it out. It really is well stocked. Now, when we do our first lecture or our first optional session on Wednesday, the 28th, I'll walk through and ask whoever joins to introduce themselves. And then, of course, there's a separate video recording where I introduce myself, so you can take a look at that if you're wondering about my background. I'm a former health services administrator, so I've worked in health plan and hospital operations for a long time. And I really believe that our job here is to make learning enjoyable for everybody, to make it value add. We're not here to torture one another. We're here to really enjoy the content and hopefully learn and grow as much as we can semester to semester. So this is my favorite quote, the fact that the more you know who you are, what you want, what you're trying to accomplish, the less you really get upset or worry about what anybody else has to say. It's about doing what you believe is right. And I love that quote. All right, so as questions come up, please reach out. This is my email. I will be in the course. I'll be checking our discussion forums, but the quickest way to reach me is to send me a quick email, and we can always chat on Zoom if that works better. But just reach out as things come up, and I will try to get back to you as quickly as possible. Thank you.